recurrent gaps and recall of everyday events. They the memory problem tends to, in other words, that when I've talked to, when I work with clients who carry this diagnosis, they tend not to, if another personality is present, the other personality or personalities are not necessarily aware of those events, and so that gaps in recall seem to manifest that way. And again, that's just by my own experience. And of course, they're inconsistent with memory, ordinary forgetting, or other forms of memory, memory impairment of other etiology. No question, folks who have this diagnosis, and or let's just say folks who have this disorder have significant distress and impairment. It is very hard to function in social roles like this. So, and that's consistent with what I've seen too, for sure. And they also put in the criteria here that two key things. One, that they want to make sure that it's that dissociative identity disorder is not confused with something cultural, okay, or religious practice. Again, I'll just speak with you what I'm familiar with or have experience with. The Catholic definition of possession is that you are, an individual is occupied by another entity, okay, another personality, if you will, but they usually don't describe it as another personality. They describe it as another entity within a person. Okay, so the DSM authors write this in a way is to caution the clinician to not confuse those. Okay, likewise when working with children, the concept of diagnosing young children with dissociative identity disorder, I don't know, I'm not sure of, and I think it could be very challenging of how do you discern imaginative play or fantasy play from even in the context of a child who's endured significant trauma. I mean, I'm not sure how you would differentiate that, and the authors, I think, of the DSM recognize the same, that you have to be very careful that you're taking into account the chronological and developmental age of the individual you're working with, especially if you're working with children. Okay, and sometimes they're not attributable to something else, and not attributable to substance intoxication or withdrawal or substance use disorder. So that's the basic criteria. Okay, is a distinction of the distinct personality states of at least two, along with some of the more, using this word loosely, common facets of a dissociative disorder in terms of fragmentation identity as manifested by depersonalization or derealization, memory and the memory impairment, and sort of persistent amnesia or intermittent amnesia anyway, as well as so those are really the hallmarks of the dissociative identity disorder. Obviously, in the criteria, marks the significant distress or impairment, which is usually probably the easiest part of this diagnosis, and then also considering that we're not misinterpreting it as something cultural or part of a religious practice, and particularly in children, that we're not confusing it with imaginary play. Okay.